A lot of women have questions about what they can and can't do after having a C-section. And it's normal to have pain because you just had major abdominal surgery. It's also normal to be a little bit sore for even up to a few weeks afterwards. And it's also normal to experience vaginal bleeding. A woman will bleed the same after delivery, whether it was a vaginal delivery or a C-section, because it's the uterus that is healing, not the vagina. And so expect bleeding for about 3 to 6 weeks postpartum, and don't use tampons. Use pads for that. And a lot of women have questions about the incision. How do you care for it? Can I take a shower? Can I take a bath? And the nurses and doctor will give you specific instructions in the hospital on how to care for it, and follow those instructions when you go home. Watch for signs of infection, and if any of those develop, then call your doctor. If you're just looking at it and it's a little bit extra sore or tender, if it's red around it, especially if it's oozing or it starts to bleed, then be checked out right away. A lot of women also have questions about what activity restrictions they may have after delivering a baby by C-section. And really, you shouldn't lift anything heavier than your baby, but you should also be able to do activities that you need to do in order to care for yourself and your baby by the time you're going home from the hospital. All of those things are okay, like bending down, getting down on the floor with your baby. All of those things are okay, but just listen to your body. And it is important to rest. Take time to bond and just sit on the couch and hold them and enjoy them while they're little. And this allows your body to rest after having major abdominal surgery as well. But it is also important to get up and walk and move around, because walking and moving around promotes healing. It helps to prevent constipation and also blood clots. As for actually exercising, don't start exercising with the intention of getting your heart rate up, and avoid abdominal exercises until your doctor has said that you're okay to do so. And typically speaking, this happens at your 8-week postpartum visit. If everything's healed and it's looking good, then your doctor will give you the green light to start exercising. But check with them first. As for getting your incision wet, it's totally fine to shower as usual, and you should clean the incision with warm soapy water and then just pat it dry as soon as you get out of the shower. But don't get into a tub and soak until your incision is completely healed and all the vaginal bleeding has stopped, and this usually takes about 6 weeks or so. And also, while you're recovering from the C-section, avoid getting into hot tubs and swimming pools. Each day when you're washing the incision, keep an eye on it and just make sure that it's healing nicely. And if your doctor put steri strips or little pieces of tape over it to help it heal, just let them fall off naturally. This usually takes about a week or so. If you're wondering if you have to follow a special diet or anything after a C-section, there are maybe restrictions like in the immediate postpartum period, like right after surgery. Because you had abdominal surgery, your nurses will encourage you to advance your diet as tolerated. You'll start with water, and then you'll move to, if that's okay, then you'll go to like clear liquids like apple juice and popsicles and Jell-O. And if that's okay, then you can begin eating regular food as time goes on. By the time you go home, you shouldn't have any food restrictions, and you can just eat a normal diet, but make sure that you're eating healthy food and eating regularly. When you're taking care of a newborn, it's really easy to forget about yourself, and so making sure that you're eating every few hours or so, and fill your diet full of whole grains, lots of fruits, lots of veggies, lean protein, healthy fats, and low-fat dairy. While breastfeeding, there are no diet restrictions unless your baby starts to have issues, and then your pediatrician will tell you if there's things that you should try cutting out. Also, be sure to drink a ton of water and to stay well hydrated, and to eat a lot of fiber, because constipation is a risk after having surgery, because it was abdominal surgery, and also because you may have not been up and moving as much, and also because you likely took pain medication that can be constipating. So do whatever you can to avoid that problem. Lots of water and lots of fiber. After having a baby, everyone wants to lose those pregnancy pounds as soon as possible, but avoid crash dieting and extreme diets, and talk with your doctor about certain diets that you might be considering that may be considered extreme or that are cutting a lot of different food groups out, and they can tell you if it's good for you or not. Be sure to call the doctor if you have any signs of an infection, like if you have a fever of 100.4 or higher, if you have swollen lymph nodes, or notice that your incision is starting to look infected, or if it starts to come open, it starts to ooze or pus. Also call the doctor if you have severe nausea or vomiting that's uncontrolled. if you have severe pain in your belly, or any signs of blood clots. And this can include pain in the calves, the thighs, the groin area, and or difficulty breathing. Also watch for heavy vaginal bleeding. As I said earlier, you can expect vaginal bleeding to last about 3 to 6 weeks, but the heaviest flow should be in the first few days after delivery, and it will gradually decrease, change like a brownish color as evidence of old blood, and then change like a pinkish brownish spotting. You should be back to normal white discharge by about 6 weeks postpartum. So if you start to pass clots that are the size of a golf ball or larger, if you saturate a pad in an hour or less, or if you are still having bright red bleeding past 4 days postpartum, you need to let your doctor know about those things, and heavy bleeding is actually a reason to be seen emergently. Also call your doctor if you have foul-smelling discharge coming from the vagina, or if you have difficulty passing urine or stool, or if it's burning when you urinate. After asking more specific questions, your doctor can give you tailored information and advice about what's causing the things that you're experiencing and determine if treatment is necessary for them. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/IntermountainMoms, and recommend us to your friends and family too.